Hello, everybody. Good afternoon. Let's go through some data, a couple points, take some questions. We've had a busy few days since Monday, which is okay. We've set up systems, infrastructure in place to fight this virus in real time, and that's what we're doing. No new deaths since yesterday. We've lost 207 of our neighbors throughout this pandemic directly related to COVID-19. Certainly we know that this virus is lethal, and we need to continue to respect it. Testing, over 4,536 tests back since yesterday. Very good testing day. We have been doing testing throughout the community. We've had our symptomatic testing at MBT Bank Stadium. In addition to that, Syracuse University has been doing large amounts of testing. They will continue to test throughout their campus as well. Moving forward, hospitalizations down to 15. That's good, with one of our neighbors in the ICU, so please keep that individual in your thoughts and your prayers. Out of those in the hospital, 11 Caucasian, 4 African American. Overall, with positive cases, we've had 4,420 positive cases in Onondaga County. That is 38 new cases being reported. Out of these cases, 5 of them are related to travel, the state of Colorado, the state of Texas, 3 within New York. 2 of those are returning college students, returning to Onondaga County to isolate. 8 contacts with the household contacts, 1 investigation still ongoing, 24 community spread with 12 of a known source and 12 of an unknown source. So when we look at active cases, 229 active cases, up 20 from yesterday, 3,989 people have recovered. That's up 18 since yesterday related to COVID. Looking at who this has impacted, 2,509 female, 1,911 male, 482 under the age of 19, 935 in their 20s, 583 in their 30s, 529 in their 40s, 644 in their 50s, 470 in their 60s, 332 in their 70s, 281 in their 80s, and 164 in their 90s. Related to school testing, just to remind everybody, again, if you have symptoms, you can get a test anywhere. We've set up designated spots at MBT Bank Stadium. There are benefits for children. The saliva test is there. That's a test that parents like better than the nasal swab, although we now have a nasal swab line at MBT Bank Stadium as well, so that we can meet the capacity and the demands. For the saliva test, you can pre-register at mychart.upstate.edu. We think that's the easiest way. Upstate did some things with their infrastructure. They're also bringing back more people to help address what is the demand, but that's the easiest way. Or you can call 315-464-2582 for an appointment, option 4. For nasal testing, the pre-registration, we ask that you pre-register before you go. It's just quicker. If you show up, that's fine. You'll just have to give the same information and wait for our nurse to input the information. The nasal swab, you go to register.cayugahealth.com and pre-register there as well. Again, you don't need to, but quicker, more efficient. Again, we're testing from 9 to 1. At 1 o'clock, results then go, the samples then go to Upstate for the saliva. They go to Cayuga Health to use our rapid testing equipment that we have there. And then the reason is we hope to have the results back within 24 hours. Wanted to talk a little bit about our asymptomatic school testing program. We will be starting this next week. What we will do is, through our partnership with Upstate, we will start asymptomatic proactive testing in schools. We waited a couple weeks because we wanted to see what was happening. What did we learn in those weeks? What are we seeing with the cases? What is Dr. Gupta and her team through contact tracing seeing so that we can implement this in the most effective way? What we have learned is, at this point, we're going to start with the staff. It seems that the staff are more likely to bring the building in than the kids. We will then move, after we start this, and incorporate children into this asymptomatic testing as well. So this will begin, essentially, it will be the saliva pool samples. There will be 12 saliva samples, essentially, per building. We will then get the building tested. If the testing comes back where there is COVID, we will alert the superintendent and the district that night so that those individuals do not go back into the building. And then the next day, then, we will take the individual saliva samples and test them individually for COVID to identify who is positive. At that point, once we have a positive, that's a positive. We start our contact tracing and quarantining right away. But we've had 2 great days of conversations and communications with our districts to roll this out. Again, we're going to roll this out Wednesday. This will be voluntary. And again, we're going to start with the employees, because that's what we're seeing. That's what Dr. Gupta and our contact tracers are telling us is the most effective way to try to go find that asymptomatic case. Again, if there's symptoms, you're still going to go get a test the way you normally would, maybe at MBT Bank Stadium, obviously, because we've set that up. But we are going to continue to do this throughout the school year. And the county is going to pay for this to start. If there's federal stimulus funds, certainly we expect that the schools, if they receive funding, will help pitch in this effort. Related to sales tax, we got another payment today, small payment, cleanup payment from the months of August and part of late August. It was off 5.91%, small payment, so it doesn't really change the trajectory of where we're going with that. Looking at the data we got this week on sales tax, between Monday's payment, today's payment, we're not going to have any disruptions to our workforce for the months of October or November. So that's positive. And certainly related to the week, we've seen really a cluster at Syracuse University. It's been well reported what happened. The good news is that the systems we have in place and the partnership with Syracuse University has allowed us to identify quickly what happened. We know, we think we know where the virus came from. We know the groups that had the off-campus party. We tested essentially the entire Greek community. Actually happy with the way that the students have responded to contact tracing and some of the leadership opportunities some of the students who had the party have taken. You know, you have a party, you made a mistake. There's real consequences. The students could go either way. They can either be uncooperative or be cooperative. They made the right call. So it's a good leadership opportunity for these kids to showcase, so we're happy about that. And we're very happy that it seems that the situation, although we'll have more cases tomorrow from these same networks, that it did not seem to spread to the campus at this point. The wastewater testing has not found it. Our other testing has not found it in the other buildings. So this is going to happen. And we've built up the infrastructure. We built up all our contact tracers. We've built up testing. We have this built up to use it when it happens. We're going to see some more cases for this week than normally we would like to. But when you look at it, we got our arms around it. We're going to wrap up this cluster, and then we're going to move forward. And there will be another cluster at some point, somewhere else in the community, and we're going to do the same thing. So overall, we'll continue to be tested as a community, but what we've been doing as a community has been working. And when you look at our region compared to other regions across the state right now and the country, we're doing well. But we just need to continue to respect the virus, and we need to continue to do the things we know works to starve this virus. Saying that, happy to take questions.
Mr. County Executive, we're in a situation where people all over the state are learning about and talking about Syracuse today. We have the mayor of Binghamton, who was hospitalized yesterday after this event in downtown Syracuse, other mayors in precautionary quarantine. Given the fact that no one can imagine that this event that was held yesterday moved the needle, Washington is just as broken today as it was yesterday as it relates to more money for local governments. Should this event have happened as it did in person and not virtually?
Yeah, I think...
And I have two follow-ups,
Sure,
if
Michael.
you would indulge me.
This pandemic, at different steps of the process, we've always learned how to live with the virus. And whenever decisions are made, people can have an analysis and can make judgments after. It looks like the event took all the proper physical distancing protocols, and the business between mayors, not just about Washington, but the reality is look what we're all facing with state budget cuts and everything else. This is pressing business. Our communities need to be aligned. So the meetings, certainly those types of meetings are essential. Could they have happened via Zoom or whatnot? Yeah, I guess they could. But from the same standpoint of effectiveness and whatnot, having a presence seemed to, fit the guidelines. It happened. Unfortunately, Mayor David is sick, and now the mayors are self-quarantining. Right now, our health departments are all talking to each other about the right protocol. These are all essential employees, so that means as long as they don't have symptoms, they can self-quarantine but still go to their office because they're essential and then go back home. So the health departments are working together on what to give the best guidance to the mayors, and certainly we wish Mayor David, who's a friend, that he gets well quickly. But this is an example for people, not so much to say should they have been together or not together, but just, again, we've seen examples of the virus over the last few weeks. If it's here, it's a problem. And so we need to do the things we can to mitigate risk with our families, and certainly it's a reminder that this can impact anybody. It can impact mayors, it can impact senators, it can impact presidents and leaders of countries. And so no one is immune to this virus.
You're fond of saying living with the virus, but this won't strike a number of people as living with the virus. They won't view it that way. They'll view it in hindsight. And given the fact that it happened, mayors are in self-quarantine, the mayor of Binghamton is ill, how can we view it with anything but hindsight and say, everyone's doing virtual things now? Why wasn't it?
Yeah, the mayor of Binghamton didn't transmit the virus here, and so that's what's tricky with the virus. Clever, right? It can. I'm sure that morning the mayor felt fine, comes to Syracuse, and later in the day he's not fine. I understand the point, Michael. I think when you look at where we are in our community with the risk of going out and being in person more, we know that that brings a level of risk. When you wear masks, when you distance, that mitigates that. Infection rates under 1%. Our 7-day rolling average, including 65 cases at Syracuse University in 1 week, right? 0.8%. That's, you can't stay locked down in those scenarios necessarily. So could those meetings have happened virtually? Sure. If I was asked to attend a similar event with my colleagues, I probably wouldn't have second-guessed, assuming that everything was being done properly and everything looked to be done properly. What was unique there is you had an event for over an hour, and the health departments are working on it to give the best guidance. But it's unfortunate. Mayor David's sick, and we need him to get better.
Where is the contact tracing on this? Do we know yet, with the hours that have gone by, how far the tentacles extend from that event in downtown Syracuse? We know there was a luncheon at the Sherwood Inn in Skinny Atlas afterwards that mayors who were in attendance say Mayor David of Binghamton did not attend. But we know how restaurants go. You sit down, then you take the mask off, and that's standard protocol. What do you know about the specific contact tracing and how it's going so far?
I know it's ongoing. It's ongoing today, so certainly you learned about it today. And that process starts, you have cross counties, so the health commissioners from all the counties are having a call as we speak. And they'll give guidance to the leaders, and then the leaders will be asked who they've had direct contact with. Again, remember, if you and I are having a meal together, one of us tests positive, just because I had a meal with you, I had direct contact with you. That doesn't mean everybody in my household's in quarantine. I'm in quarantine then, and then if I become positive, then they are. So it's every case is different. The good news is we have the best health commissioner in the state with Dr. Gupta. She's on the case, and her and her colleagues will give the proper advice, and we'll get our arms wrapped around it.
You used the term self-quarantine. Does that mean it was voluntary, or was that ordered by the health department for these mayors?
Yeah, I don't believe any of the mayors have been ordered to do anything at this point. And again, the mayors are they are essential. So even if they're in a quarantine, they can go to work, but they essentially back and forth from
But this
home to
isn't
work.
the court-ordered quarantine that we typically call a quarantine.
Yeah.
This is more of a self.
Yeah, I don't have an update on that, Andrew. Right now, it's a self-quarantine by the mayors at this point.
Have you spoken to Mayor David?
I haven't spoken to Mayor David.
Okay. Have you spoken to Mayor Walsh?
I speak to Mayor Walsh every day. So
How's he doing today in quarantine?
he's doing fine, and he's working, and he's doing fine. And obviously it's a concerning event, and everybody's going to have close calls with this, right? I mean, if everybody looks at it with this virus, some people are going to get COVID. We almost had 1% of our community have COVID. Some people are going to know somebody, and they were in close proximity to that person who then knows somebody. And so this is what this has been. We've been at this for a while now, right? This is going on 7 months worth of this pandemic, and we're going to be at this for a little bit longer. We can't get fatigued yet. But overall, this is going to happen. At some point, if you don't know somebody that's had it yet, I'd be surprised, but you will at some point, if it hasn't impacted your life yet.
I know Deputy County Executive Ann Rooney spoke to some of these mayors today. I assume suggested they get tested. A lot of these people were tested, so there's not an official quarantine, but there clearly was some guidance given on behalf of the health department.
Yeah, if you want to, in a situation like this, you want to find a baseline, and then certainly there will probably be advice given that they get tested again days from now as well. So that's the first part, is finding that baseline, and then certainly day 5, 6, or 7, probably another test.
Do you expect the quarantines to become mandatory as per, well, it doesn't say up there, but there's always quarantine.
I'm not going to speculate on what Dr. Gupta's decision is going to be with any of that and her colleagues, but again, the mayor will be able to perform his duties as mayor without a problem.
And on testing schools, real quick, on the other topic, you said 12 per building. A pool is 12. It's only 12 for one building?
It depends on the size of the building and who we have volunteering that day, but certainly we're going to go from building to building and continually go from building to building.
And will it be available to the people interested, as many as are
Correct.
interested in a day? Okay.
Correct. Yeah, I think overall, if you look at what a large cluster looks like, you usually go up a peak and then eventually come back down. What this is essentially, we went like this and are going like this. So 20-20-20 is a flat line. It's not just the number of cases related to SU, it's who they are, where they live, what organization were they involved with. These are not random kids across the campus. Was it? Yeah, it was an off-campus party. I'm not going to get into specific names of the affiliation. Again, you know enough about this, right? They've tested all Greek life, all off campus. They're starting on campus. We know that the situation, all the positives are related to the event, and it seems to be contained at this point. That's what the data is telling us. Certainly the university is going to make their decisions with is there any discipline or not related to the event. My advice to all students, and again, I was a student once, I remember like yesterday, but it was a while ago now. But I get when you get to campus and you got friends at home, all right, I got my buddy at this school, let's go visit for a weekend. I got a boyfriend or girlfriend somewhere, I got to go see him. Like, not during a pandemic. Because what's happening is kids go to other schools. We've seen this probably 3 times now. And I'm not just speaking specifically to SU. They go to other schools. The virus, a couple weeks ago we had cases where kids went to Oswego for a party. Oswego had a problem. They come back, bring the virus here, and it takes us a while to get on top of that. So my advice to students is, you are in one of the safest places to be on a college campus in the country. You have the tools you are to start and prepare yourself for the next chapter of your life. You have friends there. You can still see your friends. You just can't have parties. Don't blow it, okay? And so what can happen by blowing it? Having large parties, that can blow it. That can ruin it for everybody, okay? Going away to visit somebody at another college that has more cases and coming back, you can bring it with you, and that has happened. So yeah, there's indications that could have happened here. Mm-hmm.
Brian, going back to contact tracing efforts with the event that happened with the mayor, when it comes to contact tracing, about how long do people expect calls after they were at an event where they may have been in contact with someone? Because we had members of our team at that press conference yesterday. They have not been called by the county health department yet.
Yeah, so I'm not Dr. Gupta, but they should probably quarantine or start their quarantine. But the reality is you work through. So you had mayors, you're going to call the mayors first, talk to them, investigate everything with them. Then you're going to go to their next level, then the next level, and the next level of who is there. So usually within 24 hours, people have been contacted related to all of the contact tracing. You will have times where it's a very complicated case. This is very complicated. This is 10, 15 mayors, different parts of the country, or the state, excuse me. So that a little bit more complicated than your typical contact tracing effort. So I think important is the health commissioners need to be on the same page on what the recommendation is to the mayors, than what the recommendation is to all the direct contacts, including members of the media as well.
Is there concern of exposure for everyone who was at that event?
I think at the moment, I think everybody should just be cautious. Wait to talk to the contact tracers and the doctors, and then, but certainly if you were there, it's a good idea to be cautious.
You said if you were invited to an event like that, you probably wouldn't have thought twice before going. When was the last time you went to an event like that or a conference?
Well, I was with county executives earlier in the week.
What kind of precautions were taken there?
Exact same. We're all there, all doing any sort of precautionary screening that you had to do, and physically distancing, mask wearing. But our jobs are not jobs where you can just be isolated at times. At times you have to get out and you have to learn when you face the challenges we're facing. So I was with colleagues, and we didn't have a press briefing, but we had meetings where we talked about what was going on at the federal level, at the state level, best practices in fighting this pandemic. We heard from some amazing speakers, 2 generals, including General David Petraeus. So these are all things that they're going to happen, and that's part of our job. I have events where I'm in the public. That's part of my job, and so this happened. We're going to contact trace. We're going to be all over it, and hopefully we only have one person who's COVID positive.
Politically speaking, can you gauge the usefulness of an event like yesterday among the mayors? Politically speaking, because we know you know politics.
Yeah, I didn't hear, Michael, exactly what they're doing. I know they're talking about federal aid. I know
it was a cry into the wind for federal aid.
Yeah. So one could argue, haven't you already said that? Don't you say that twice a week, Ryan? 3 times a week? Sure. There's a little bit more force. You had a bipartisan group of mayors from all over the state talking about the challenges they're facing. And that's from the Conference of Mayors, the organization, that's their job. And so they were doing their job. And so whether it's effective or not, this is a deal. The stimulus deal at this point is a deal between the Speaker and the President. And if they can agree to something, the President will have to leverage the Senate. And so whether or not it was effective to put pressure on the Speaker and the President, I don't know. But that's NICOM's job. NISAC has a job. And I think they took every precaution that you're supposed to take with the best practices given.
Would you clarify, just to make sure we're clear, is it simply too early in the contact tracing to know if there will be mandatory quarantines, and right now people are proactively, precautionarily quarantined until the health department does
Correct.
what it needs to do?
Correct.
Okay.
Yeah. I mean, I got a call from the mayor, called me this morning when he found out, 9 o'clock. We started talking. He had already talked to Dr. Gupta. I brought my team in, said we got to have all the health commissioners on the same page on this. You can't have one mayor being treated differently than another mayor across the state. And they're working through that.
When it comes to contact tracing, this actually seems like one of those rare times where it wouldn't be complicated. We have all the names of the people who were there in terms of the mayors. We have their, press people and the people that would have been there, as well as the names of the media outlets that would have been in attendance. So do you know how many people have been contacted yet and how long it's going to take?
I don't ever,
that
so
list?
Connor, just to understand, I know more about this than a normal case because of the information that's been shared with me by the people involved. Even though you have, who was at the event, and that's been shared with Dr. Gupta, you have cross-jurisdiction here. And so the health commissioners need to be on the same page. You could have one mayor saying, I was on the other end of the room. I wasn't near him all day. I'm not quarantining. I was 25 feet away from this guy. So, but then you could have one saying, I was 8 feet away. What do? I was 10 feet away. So the doctors need to talk and figure out the guidance to give to the elected officials. And so once that's done, then the contact tracing and the quarantining is a lot easier. But you had 15 or 20 people. Some of you, I don't think anybody in this room was there, but your colleagues were. There was a lot of people there. So if Mayor David's over here and someone's over there, the elected official might object to being in a quarantine because I wasn't near them. The doctors need to give the advice and figure out the protocol, and that's what they're working on.
Is the county in contact with the Sherwood Inn?
I'm sure if there's reason to believe that people should be quarantined or a gap in the investigation of the Sherwood Inn, I'm sure that will happen. I don't think so. I think this is a virus that if somebody brings it into a confined space and you aren't wearing masks and you're not distancing, you're drinking, you're sharing drinks, I don't know what happened. But if there's lots of spread in other parts of the state and the country when people aren't wearing masks and they're together in close proximity. So my guess is that's exactly what happened here. And you've had cases from it. And so we know this, though, right? So we all know the best practices. There was decisions made by those individuals. There's decisions made by other individuals who are positive that they weren't practicing best practices either, and they got sick. So now it's just important as a community. This is a reminder that it's still here. Even though our rates are good, even though we've been through a lot, even though we're tired, and probably tired of talking about COVID, it's still here. And we're buying time for science, and science is catching up. No. Yeah, we don't think so. Again, we don't anticipate that number being hit tomorrow, and then the number starts over. And again, Syracuse University, it's kind of tough when you look at this rule. Is tough on SU, tough on Cornell, big colleges. what's 100 divided by 18,000 kids? 0.00 what? So that rate, even at 100 students, is better than anywhere else in the country. Yeah, they got to go to online learning. It's a tough rule for the big schools. So again, a problem at a school that size is, do you have 500 cases, right? Even though the rule is 100 over 2 weeks, you know, is it more than what you want? Yeah, but that's not necessarily outbreak. And so even the good news on this case is all indications are we've wrapped it, we've boxed it in. The quarantines are there. The randomness of who the kids are, there is no randomness. There's a story behind that, and it's the story that makes us lead, that gives us hope that we've boxed this cluster and this one's gone. We'll wait for the next one. Yep. If they don't have 100 tomorrow, then the clock starts on October 10th for a new period, October 10 to October 24. Any college that gets 100 within that period then has to go 2 weeks remote. So they had 65. Highly unlikely, knock on wood, we're going to get 35 new cases out of SU tomorrow.
So just coming into the press conference today, we did have a member of your team actually reach out to CNY Central to double check that none of the people that were at the mayor's conference actually come in attendance today. Why did that contact happen, and why haven't they heard from the health department yet?
Connor, you did hear from us if we called you.
Not from the health department, though.
Well, we were thinking about you. We were thinking about you, or else we wouldn't have called you. But the reality is they'll call you. Whoever it is, they're going through their operation. So I know it can be scary, right? This is all scary, but it's the process and it's working. We knew something about the fact that there was media at this event. We wanted to make sure that those media folks knew that this happened, so that they knew that they could self-quarantine until they get the proper guidance from the doctors.
Does that also show concern, though, that you're concerned that people in those rooms might have been exposed and that they may not have wanted to come to the presser today?
What was that?
Does it show concern on your part that people in that room may have been exposed if they were looking to see whether or not they'd be in attendance at today's presser?
Oh, of course. I mean, everybody could have been exposed. There's somebody there who had COVID. So that doesn't mean they were, but they could have been. So therefore, let the investigation happen. Again, it's about 5 business hours long, and we'll get through it. But we're not going to, in our world, when we interact with you folks so often, we're not going to say, hey, you should self-quarantine. We gave you a heads up because we knew that this was going to be likely that you'd get the phone call. So we're looking out for you.
Do you have any plans to alter the testing sites as the weather starts to turn?
We're looking at it. There's a couple sites maybe that are more indoor related that we're looking at, but that will obviously become more of an issue as it gets colder and the snow starts to fly. But we will continue to have the testing available. So there's a couple potential sites that we've looked at, and hopefully we'll be under control to continue this testing moving forward. That it?
Last week, you know what I'm going to ask you.
Yeah.
Last week you said that you were going to schedule a test for earlier this week. Has that happened, and do you have a result?
So I got a test. I'm going to do a saliva test, Trish, and I'm going to do it on, I think, not Monday, but probably Tuesday. And then that way the questions can be put to bed.
Well, I think we all know it's a moment in time.
Yes. Yes. So again, I'm going to do that just to do it because I haven't had one. Again, everybody in my family, some people have had procedures. My son Andrew at one point had a runny nose. 3-year-olds and 4-year-olds get runny noses. So in this world, that means they get a COVID test. And so my household has been tested except for me and my son Jack. And we are definitely the 2 biggest babies in the house. So, but I will get the saliva test on Tuesday.
Housekeeping question, briefing Monday or not?
No briefing Monday, but Tuesday.
Tuesday instead.
Yeah. Yeah, I think this is tough when you're talking about enforcing executive orders, and you got to find the ability to be effective in a way that's proportionate to the challenge at hand. And so I think what the university has seen is they've seen a couple incidents, not a lot. For the most part, most of the students are doing excellent, where they need to set a tone. And I think because it's so big and so many kids are doing the right thing, a few kids can make a mistake and it can ruin it literally for thousands of kids, and for our community as well. And so I think they've seen it. They want to set a tone. I think what they're doing is smart. Again, this isn't the year to go to college and think it's about partying. This is a good year to go and be serious about your academics, enjoy the community, enjoy the campus, enjoy what it has to offer, and we'll get through this. At some point, people will be able to be back together again, but it's not now related to what are some of the traditional extracurricular activities that come along with college. So I think they're setting a tone. I'm happy they are. The chancellor, the vice chancellor, they've done everything they're supposed to do. And because of that, they've had tremendous success when some of their peers have not so far in the school year. Anything else? Okay, everybody.